So we're going to move in quickly to our return to in-person learning portion of our board meeting tonight. We do have a number of things we've worked through. We still have a number of challenges of things we still need to overcome. And so I'm going to turn it over to Dr. Udosnata and Dr. Sproles. And if you can go through at a rapid clip, how about that, so we can get to our final agenda item.
You got it.
That sounds great.
Dr. Sproles, you're on.
All right, thank you. So here's just a snapshot of where we are in time, and knowing that this is kind of a continual update that we'll bring before the board as we start gearing up our organization to have kids back for in-person learning, or have more kids than we currently have in limited in-person. We have COVID liability protection that was passed by the legislatures. We talked a little bit about the RSSL guidance that came out last week, and we'll talk a little bit more about that today. As you all know, we were excited that educators were placed not exactly in 1B or 1A, but kind of in the space between to be able to get vaccinations. And we have been moving forward with our vaccinations with a really strong partnership with Salem Health and Marion and Polk County as well. And we are one of only a handful of states who are pushing forward with vaccinations for our educators. And we think it's important to realize that what this means for our community is that it's not if we're coming back for instruction, we are coming back. And so it's the when and the how that we're scheduling right now. And we're getting those logistics figured out with lots of conversations with educators. So here's just some updates about our vaccinations. And the important thing for people to hear at this point is that we are back open for vaccinations, opening up to all district staff starting tomorrow at the fairgrounds. And it's sponsored again through Salem Health. Director McDaniel, do you want to add anything here just to make sure we get the right information out?
Just quickly, all the appointments for tomorrow have been taken. So I do know staff are signing up for Thursday and Friday.
Thank you. And there's you can go to the Salem Health site, which is on a Facebook site, and they have all the information about how to get registered and signed up for a time to go to the fairgrounds to get your vaccinations.
Oh, okay, so did we cover everything we needed to on that one, Dr. Sproles?
I think so. Thank you.
Okay, no problem. So as you know, on January 19th, the new metrics came out and we reviewed those. And what we want to do is highlight the 4 substantial updates. There was a handful of updates, but here are the ones that we really want to bring to the board's attention. First, as a repeat from last week, metrics are now advisory. So whereas they were mandatory and mandated by the state, they're now advisory, and it's going to be localized decision-making on our metrics. Now, we still have numbers that we need to abide by, or that we're being requested to abide by as advisory. So the COVID number per 100,000 is been changed from 200 to 350. And we're pleased to announce that our numbers did come down last week. So we're actually inching close to that 350 number. But those metrics are advisory, and we're going to go into depth on how we're going to do some decision making around using those metrics. Also, we need to implement a school-based safety team, and we already have school-based safety teams. So really, what we need to do is strengthen the function of those teams and to make sure that they have adequate oversight at the site-based level to monitor safety procedures. And we'll talk a little bit more about what those safety teams will do. On-site COVID-19 testing. All schools, if we are in a high risk area, which Marion County and Polk County are required to offer COVID-19 testing. And COO Mike Wolf will share more about that in a few minutes. And we need additional training to ensure understanding of protocol. We'll talk about what that training looks like. We're currently working with our associations to make sure we have the proper input on what training will be needed before we bring staff back. And we want to do that before students come back. And then districts must offer a comprehensive distance learning option. we have the EDGE program. We'll talk a little bit more about that as well. So real quick, let's talk about these school-based safety teams. So every building it has its own unique structures, and they have their own blueprints. And what they do is they assemble a safety team. Now they had existing teams that met monthly to make sure that all safety guidelines are being followed. Now what this group will do now is the frequency will increase, and they'll instead of meeting monthly, they'll meet weekly for the first month of, and actually before the first month of in-person instruction. They'll start almost immediately. Once they're assembled, they'll start meeting weekly. And then twice per month after the first month of in-person instruction has resumed at their site. The membership of these groups will be 4 members at least, and it'll include representation from SKEA and ASK-ESP. The responsibility of this group is to review safety and address matters related to safety. So some things that they might discuss at their meetings is compliance. There might be issues around where staff are congregating to make sure that we're addressing those concerns and providing space for staff to go, or guidance where staff can go during their breaks. Check-in and check-out system, and making sure that they're interacting with their physical distancing coordinator, or any other issue, safety issues that might arise due to our COVID-19 protocols. And then they will report to our safety and risk office. But again, they'll be interfacing with the physical distancing coordinator, and each school does have a physical distancing coordinator. So here's the timeline for bringing students back to blended learning. Again, the term blended learning is also interchangeable with hybrid that might be used at the state level. So elementary timeline, it's shifted just a touch. We're looking at bringing students back in early March, and that would be K1 and 2, and then we'd add incrementally every week or so, with the full blended model K5 target date being March 15th. At the secondary level, third quarter, we're going to expand LIPI. So that's limited in-person instruction. Our principals already have plans to bring in a lot more students. They're right now doing some decision-making around which targeted groups to bring in. But we know that at the high school, seniors that are on the fence or need extra support, and students with disability and struggling students that could benefit from in-person supports will be the ones that have the first opportunity to come in for limited in-person instruction. Also in the third quarter, we're going to continue to follow OSA guidelines, and that are county dependent right now for COVID-19 metrics, meaning that if we're in a high risk category according to those metrics, full contact sports won't be eligible to participate yet until we get out of that high risk. But again, those guidelines are being updated. And so if we find out something new, we'll be the first to let you know. And then the fourth quarter, that is when we're anticipating bringing students back in full blended. So, and we have our high school leadership teams working on what that, and so as our CAPS and our director of high schools and our director of secondary curriculum, working on different models of what that might look like, looking at what the scheduling implications are, and making sure that we're thinking outside the box to give our students the most robust blended learning experience that they can have. And so that's all I have. I'm going to pass it back to Dr. Sproles. And actually, I think this is going to go to Chief Operating Officer Mike Wolf.
I have a question. Chair.
Yeah,
Chair, I have a question.
Marty, sorry, Director Hine, why don't we just complete the presentation and then we will open the question.
Okay, I'll jump in. So based on our timeline of bringing kids back in the blended model or hybrid model, you can see that the Ready School Safe Learners requires us to offer the rapid COVID-19 tests. And so we're putting protocols in place to do that. Oregon Health Authority states that the test must be self-administered. And of course, the specimens then would be collected by the person being tested, which is the person that is self-administering the test, but under observation by a testing administrator. Some of the things to be focused on is this is a test for symptomatic and exposed students or staff only. It's not a screening tool for individuals interested in if they have COVID, right? So it's not the asymptomatic individuals. And OHA says that they basically say if you have trained medical professional staff, they could perform the testing administration. However, it's not necessary for them to do that. So we're looking into this because we want to make sure that we're doing it in the most consistent manner across the district. And we're in process of figuring out exactly how to do that.
All right, thanks, Mike. So here's our decision-making model moving forward. And the reason we need to articulate this model is because remember in the past, the county-wide metrics have really determined if we can open schools and when we open schools. Now that this is up to a localized decision-making, we need to be able to have a tool to be able to say, how will we make decisions? And I think it's important for us to still consider the countywide metrics as one of the data points that we will take into consideration. And as Dr. Udosanata mentioned, our rates dropped almost 100 points in the last 2 weeks, which is great news. And so we're closer to the 350 threshold as it stands right now. But with the new guidelines, that's only one data point for us. We also can look at school-specific data. And a good example of this would be Marion County is a large county, and we've experienced outbreaks that are pretty specific to specific locations or neighborhoods within Marion County. But if we use that as the decision-making tool to govern how we are going to operate all schools throughout the county, it's a pretty blunt instrument, quite frankly, to be able to determine whether we should operate schools. And so we are currently collecting school-specific data on the number of COVID cases, the number of outbreaks, the number of people who are being tested, information like that, which is much more fine-grained data on the localized level. The second thing is we need to ensure that our safety protocols are being followed to the letter. And we've engaged in blueprint review teams, and Ethan also mentioned the safety review teams, which will serve a really important function for schools to be able to monitor themselves the implementation of our safety protocols and have a reporting structure for if things aren't being followed and if there's concerns at the school level to be able to address those. We'll also have ongoing collaboration with our local health authorities, and we have an excellent relationship with Marion and Polk right now, and having that relationship makes a huge difference and pays dividends for our kids to be able to get us back into school. It also pays dividends then when we do have an outbreak. And I think it's important for us to realize we will have COVID introduced into our schools. When it's in the community and people are in the community, it will come into the schools. And we have protocols in place to be able to safely take care of that. But that's working with Marion and Polk as well. The fourth thing is access to vaccinations. Several of our teachers and our educational staff have already got vaccinated, and we're anticipating that they will get the second dosage in time to be able to be vaccinated before we start our blended model. Now, I think it's clear to state this isn't a requirement for staff. It's just an added layer of security. So each one of these is an added layer of security around COVID-19. And then finally, we have the ability now, or at least a path, to be able to offer rapid testing at the school level. So if somebody does show up symptomatic, if a child starts displaying symptoms during the day, we have an ability to be able to rapidly determine, is this someone who could be exposed to COVID? And then what can we rapidly do to respond to that? And that's where our cohorting comes into play. So all of these different steps create a model where we would be confident to be able to open schools, even if our countywide metrics are still high. Can we go on to the next one, Dr. Udosanata? Thank you. So here's our next steps that we are working through. First and foremost, we're in a really tight collaborative relationship with our teachers to establish an elementary schedule. And we feel like once we have a schedule, then we can start communicating to our elementary families first on this is what your day would look like. This is what the experiences of your student would be at school, things like that. And there's lots of parts. A schedule is also is what will determine our transportation ability to meet the needs of all of our families. And as we spoke about last week, transportation continues to be a big logistical issue that we are trying to overcome to get kids back in school. Another next step is we are beginning to communicate with our school community. These presentations to the school board are one touch point for our community, but we have lots of others that Ms. McDaniel and her team are developing. We talked a little bit about the blueprint reviews, and remember the blueprints are the guidelines that were set out in the Ready School Safe Learners, and we actually submitted those to Marion and Polk County health officials. They accepted them last summer. So we went through all of the blueprint guideline recommendations already with our school teams, but that was several months ago. And so we need to revisit those plans, and that's what we're doing right now. We also need to finalize our classroom modifications. Our custodial and operations staff have been doing a lion's share of work to move furniture to be able to make space for what our new classrooms look like. And they look very different than our traditional classrooms with all the space spread out. And then finally, we're encouraging families to engage in rider registration. And what this means is for when we start coming back, we need families to tell us, will they need transportation to be able to come back to school in a blended model? We're anticipating that some families will choose to drop off their children, where in the past they might have ridden the bus, and that will greatly impact our transportation system. So those are just a few of our next steps, Dr. Chandragiri.
Well, thank you. If we can go back to all the for the sake of making sure we proceed to the last section of our discussion, I'm just going to call one by one. If you can just state one question. If you have any other, I'm sure all of us have many questions. Please email them to Superintendent Perry, and then we can get other questions answered. I want to start with Advisor Mebinton, then I'll go to Director Hine. Advisor Mebinton.
I had questions, but they were actually answered in the chat, so I think I'm good.
Very good. Director Hine.
Yes, so it sounded in the presentation like the only place the staff members was going to get information regarding getting the actual vaccine was Facebook, and not everybody has Facebook. So where even if the superintendent is communicating, where, for the public, where are the other places that staff can get information on the vaccine, getting the vaccine?
Yeah, just as I'll just answer quick. Sorry, Ms. McDaniel stepping in, but we do an all staff email when we have open slots, and then we link how they can sign up. We also tell them watch the Facebook if you have access to watch for future, but we're on our second or third all district email, so they get it in their inbox.
And I try to make sure I send it to the board as well. I believe I sent it on this morning.
Vice Chair Bettel, do you have any questions?
I don't have any questions, but I want to share, because Oregon Health Authority sometimes is a bit behind on its data. And today, in my day job, I was lucky enough to receive the information that Marion County has vaccinated over 45,000 individuals in their first round dose, which is significant. We're leading the state in that in Marion County. And the fast-paced effort that our superintendents pulled together with our health authorities, Marion and Polk both, put Marion County ahead of the process by about 10 days to get educators in that queue, in staff as a whole. And we estimated there's going to be anywhere between 10,500 and 11,000 staff total in Marion County. And we've already pushed past approximately 50% of those individuals who wanted to opt in for that vaccination. So well done to your communication team and to our staff that show up to get that vaccine. When they were told go last week, they went. I went down to the Salem site and watched multiple people that I know funnel through that line to get those vaccines. I'm so thrilled that they're engaging so we can get kids back in school. I just can't even tell you. So thrilled. So that's all.
Good job. Thank you, Vice Chair Bethel. It's beautiful. I got my second shot, I tell you. It makes a difference. Anyway, Dr. Blasi.
I did have a quick question for our elementary schools. What is the plan for some of the self-contained classrooms in the elementary schools for students where it may be more of a challenge to have them socially distance?
Yeah, do you want to take that, Dr. Sproles, or you want me to?
I think we're going to say the very similar answer. So go ahead.
So our Director of Student Services has met with all of the teachers in those self-contained classrooms, and they're trying to do a bit of a school-by-school approach based on the classroom they have and the types of needs of the students and numbers of students in those classrooms. So there's a variety of approaches, and it might be good for us to come once they've solidified those to kind of come with some general, here's how we're handling them. She is working closely with them, but a lot of them have also been bringing their kids in for limited in person already. So we do have lots of kids coming in and our students with disabilities. So they're practicing a lot of those safety protocols and things ahead of time. One of the reasons we were able to vaccinate a good number of educators is our special education teachers who work with medically fragile kids actually qualified in group 1. So that's especially for our educators who are working with really vulnerable populations. We feel really hopeful that the vaccination adds that next layer of protection for them.
Dr. Goss. You have to unmute Dr. Goss. Can't hear you. Is there any other way to unmute Dr. Goss?
I can only ask her to unmute, but she'll have to press the unmute button herself.
They're unmute.
Okay, there you go. Now you're right.
Okay. Are those emotional growth centers or the EGCs that we're talking about in elementary?
We have EGCs, we have DLCs that are for our medically fragile students. We have our, gosh, there's another one, our SKIP, which is our students with some more compromised behavioral challenges. So they're all kinds of elementary self-contained classrooms. EGCs are just one of them.
Thank you. Dr. Lepol, do you have a question?
Yeah. So I understand that I'm going to have quite a few, but I do know that I understand that our role, can you hear me?
Yeah. Yeah.
Oh, sorry. I thought I heard you speak. Okay. So our role, right, is to look at 30,000 feet high, very macro approach as to what we're doing here. At the same time, just because of what we're dealing with, and for me, my sister's going to be going to North, and so as when and if that opens up this year, hopefully, I also want to make sure that things are safe, teachers are safe, kids are safe, parents are, right? Because that's a lot different than our own personal views on what we can do for ourselves, depending on our risk level, right? And so, on that, I understand that there's a plan and what we're doing, but I would love to hear and learn more about what the logistics are in a classroom, right? Mm-hmm. And what that's going to look like, because it'd be really cool even if we had, similar to how we've been having videos about each of our schools through the Bond Project, if we had one that walks through a classroom, hey, here are the safety measures that we're taking. Mm-hmm. So that way people can know in their heads, we're not just going back to as business as it was, but we're also still trying to doing our best to keep people safe. I've just been hearing a lot of conversations around the state and with, the Native American Council on the national level about those kind of conversations. And so I would love to hear and see what we're doing within a classroom logistically.
Thank you.
So I think we can bring that into a future meeting too. But one of our things we've been thinking about is as we think about as we can get an elementary schedule solidified, which is just taking, a lot of conversations. But as soon as we could get an elementary schedule solidified, we do have a couple elementary schools that have really expanded LIPI and have their safety protocols and procedures safe. And we've thought about, could you start a couple elementary schools early, and then we can go in there and be sure to capture video and pictures, and here's what it looks like, because they become learning labs for our families to know what it looks like, and also for the rest of the district to learn some best and promising practices. So we've thought about that. It's just a matter of, and they're ready, but we've got to get the elementary schedule nailed down first. So those are great ideas and all things that are on our minds.
Director Kylo? I can't hear you.
No questions, no comments.
Thank you. I have a question. It's a tough choice we have to bring kids back. I see a lot of students are going through severe depression, and a lot of them are struggling with thoughts of suicide. And I just want to know, how are we reaching out to them, or how are we scaling up the counseling, or even on the days when they are not coming to school, because they are feeling left out, their attachment system with friends and other support system is essentially gone. So what are some of the concrete steps that we are taking to scale up how we are reaching those students, a large number of them, including the ones in high schools, with thoughts of suicide, feeling kind of despondent about their future?
So that's why we want them back in person on a greater level than we see them now, because we do have a whole big number of strategies. We've had an ongoing counselor support line. Our counselors meet with kids individually. We've got all of our mental health providers that are providing services to our kids. But when we can get them back in person, having eyes on them one-on-one in a building where they're in person, we think is the next most important step. We have hired more counselors with our student investment account dollars. And again, we've expanded all those mental health partnerships that we've told you about in the boardroom. But we feel like there's a mental health crisis. We need to see our kids.
Is there any, just a follow-up, is there any way we are kind of getting the word out? Here are the people, but just like when we initially introduced the suicide prevention policy, we kind of took an effort to get the word out. Are there any concrete steps we are taking to get the word out and kind of re-educate the community and the students and their family? Even on the down day when they don't come to school, here are the counselors' names, places. I don't know, they used to be the badge, behind
I'd
the
love
badge.
to answer that from a parent's perspective, because I have 2 kiddos in the schools. And just before this meeting started, I received a, what's that app called that we use? I can't remember. Remind. Yep. Yeah, sorry. From my 7th grade daughter's English teacher, who, she's sending it to the students ultimately, but parents are copied on that if they have that cell access. And she was just giving us some pointers like, hey, we're transitioning because we're going into a new semester for some of these for the kids. And she gave us some pointers. And so for me, it's been access from the teachers. They're interacting with kids, even in a limited capacity through a window. If they see a need, they seem to be launching right out there. And I got a call from a counselor at Whitaker for my daughter because she had missed a couple of classes last week. And it just happened to be a hiccup in the attendance system. But they wanted to know, hey, where is she? Is there anything we need to be doing? all those details for me as a parent have been fulfilled. I'm sure there's holes, but that's what it's looked like for me. And the touch is constant in one way or the other. You guys have really picked it up over the last few months, in my opinion, and I'm seeing it anyway.
And one thing I wanted to add is that our high school principals are now they started this week sending out a weekly update to families. And in those weekly updates, they'll highlight important dates, but they'll also talk about things that families should know, and including links to resources and little tidbits and reminders about how they can support their students and the resources we have available to support students as well. And so we are working to develop a more robust online community where we know that we are not going to, that we're going to have to think differently about the way that we engage families. Even when we do bring students back to in-person, we do want to find a way to stay connected and help families stay connected with the resources that we provide.
Well, thank you very much.